So good morning and good afternoon, everyone. My name is Breck Rice. I'll be your host today on the Community Pharmacy More Profit Roundtable. And so a couple of fun announcements. First off is that this meeting is always available to you for the replay on YouTube. The YouTube channel is Healthcare Disruptors. And now it's also becoming a podcast. So it'll be available also on Spotify and Apple as well. So more exposure for the great vendors who come on and who share their support to this program, and also gets more exposure for the wonderful products and services that they bring to the table. So I've been helping community pharmacies for over 20 years now. I absolutely love the industry. I'll do everything I possibly can to help community pharmacies be successful. And so that's why I've launched this roundtable to bring in new things that could improve the front end profitability, and also bring in services that all of the services bypass the PBMs. So I got involved many years ago with community pharmacy, and saw the the profit margins really decline over the years. I had my own personal experience with a big PBM, and so I wanted to get involved in PBM reform. And so that's why I also host the PBM Reform podcast on the Pharmacy Podcast Network. And as you can see from this slide, kind of preaching to the choir here for community pharmacies, but you see that all the payers have aligned to go against community pharmacy. We call it the PBM and insurance mafia, and their goal is to put community pharmacy out of business, and we cannot have that. And so we want to boost your profitability. We have pulled together some amazing products and services to help you. And in the last couple of years, it's been pretty bleak for community pharmacies. And so I've never been more excited, though, for the opportunities that are available to community pharmacies now. So super excited to share some of those opportunities with you today. So I'm a firm believer that 1/3 of your revenue needs to come from non-dispensing. And that's really hard for our independently owned pharmacies, because you don't have the front end space, or you don't have all the supermarket products that the supermarket pharmacy chains have, or the mass merchandisers. But there are still ways that you can bring on new products and new services that can boost your profits here. And so we want to talk about those. So some of you know that when I was a little boy, I got the opportunity to live up in British Columbia, Canada for a little while. It was really fun. And of course, the primary sport up there is ice hockey. So one of my all-time favorites is the great Wayne Gretzky. When interviewed what made him such a great player, I love this quote. He skates to where the puck is going to be, not where it has been. And that's really what we need to do in community pharmacy. We need to go to where the profits are going, not where they have been. And so that's why we've launched this program. So want to share a little bit about our program, the ServeRx. There's a quick explainer video here to share with you, and then I'm going to turn some time over to my friend Will Shaw to explain more about how we bypass the PBMs to help community pharmacies get the fair reimbursements they deserve.
An injured worker comes into your pharmacy. What do? Do they have a PBM card? Who is their carrier? Will I have to make a bunch of calls to find out? Will I get paid? And if I get paid, will it even cover the cost of the drugs? Don't worry, just send the claim to ServeRx. They will do all the work, guarantee payments, and you will even make more. Less work and more money. What do you have to lose? You are probably already contracted through your PSAO. All you need to do is enroll. www.serverx.com.
Yes, great morning, everybody. My name is Will Shaw. I'm a account manager for ServeRx. And like Breck said, we love helping our community pharmacies. This is a free service, like the video mentioned. You probably already contracted if you are with the PSAO, and I can help you get registered. ServeRx, we have no affiliations with the PBMs, so we're able to maximize the pharmacy's reimbursement on workman comp claims by keeping them out of the PBM networks. For example, as you can see our chart here, if a patient was to come into the pharmacy and they needed a meloxicam, if you was to process that meloxicam through a PBM's bin and PCN, your pharmacy may be reimbursed $3 to $4 for that medication. Now, that same medication, if you was to adjudicate through ServeRx's bin and PCN, we are seeing pharmacies being reimbursed anywhere from $101 to $105. And if you are with the PSAO, that will be reimbursed to your pharmacy within 30 days once we invoice. If you are an independent pharmacy, that will be reimbursed to your pharmacy directly within 45 days. And how we're able to give the pharmacy a higher reimbursement on those workman comp claims is we reimburse the pharmacy at AWP. So for brand medications, we reimburse the pharmacy depending on your state schedule fee, but majority of them for brand medications, AWP, 85% for brand medications. Then for generic medications at AWP, we reimburse the pharmacy 70% plus a $2 dispense fee. Okay, we do have a live help desk that is available 7 days a week. So if the pharmacy was to receive a rejection for a claim, you could give our help desk a call and we can help you receive that pay label for that claim. Like the video mentioned, we just want to help take the work out of workman's comp and help keep those fair reimbursements that the pharmacy legally deserve. I did go ahead and put my information in the chat, so you can reach out to me, send me an email, give me a telephone call. Again, we can help you easily get set up. It is a free service. There's no enrollment fees, no annual fees, no monthly fees.
All right, thank you, Will. I appreciate it. And for those that are new to our program, we do understand that you do have contracts, or your PSAO has put you in networks with some of the PBMs just out of necessity, right? So like a good example is United Healthcare. If you want the 65 million lives on the commercial side with United Healthcare, they unfortunately bundle their networks and force you to be into Catamaran, Cypress Care. And we understand that, but still approximately 1/3 of all workers' compensation is going to be outside of the big three, Express Scripts, Optum, and Caremark. Those 1/3 of those work comp claims will be self-insured employer groups, and we can help you with those and manage those claims for the life of the claim. About 50% of all work comp claims are going to have multiple refills. They're going to have 8 to 12 refills, and so that's really good business for your pharmacy. So thanks again, Will. And to attract more patients, and the very best way to do that is to detail your physicians in the area, specifically, pain doctors and orthopedic, podiatrists, anyone that would have a high number of workers' comp. And to help with that, we have partnered with GRX Marketing to help you attract more work comp patients, because that can really provide a tremendous boost to your bottom line if you can find more workers' comp and process it through ServeRx. So is Kelly or Erica here today to talk about GRX program?
Yep, I'm here. I'm Kelly.
Hi, Kelly. Thank you so much for being here.
Yeah, absolutely. Thanks for having me. So yeah, kind of like you mentioned, processing workers' comp claims through ServeRx is great, but it's also super beneficial to make sure that providers and everybody else knows about it as well. And so we can help pull a list of providers in your area based on specialty, like you said. We can educate them about the ServeRx program and how it works, how the patients benefit from not having to wait, all those different types of things, provide consistent outreach. We can do, depending on what state you're in, we can do physical mailings, or we can potentially do, geofencing campaigns as well. So any sort of digital outreach to make sure that we're hitting them multiple times to make sure that they fully understand and see that. We can also assist with writing content for your website if you don't already have something on your website about workers' compensation claims, which I highly recommend doing, just because if somebody is trying to find a pharmacy that accepts workers' compensation, making sure that you're findable is ideal with that. So, yeah, this slide just kind of goes over, what's included within our marketing program. We'll put together a marketing plan, a, monthly targeted mailing to providers based on specialty, like I said, a targeted address list, monthly supplement print materials, so we can provide things in the pharmacy as well, such as, brochures or bag stuffers or coupons to make sure patients are aware of the service that you offer as well. And then any additional add-on marketing beyond that. So things like social media posts or digital campaigns, things along those lines.
Excellent. And then you also provide custom website solutions as well?
Yeah, absolutely. If a pharmacy doesn't have a website or if they're looking to revamp one, we can also help build a website. We do offer that as an additional service. Every website we design is completely custom made for each pharmacy. We don't use like templated styles or whatnot. So we work with you to figure out what style you like, what features and functions you need. We can integrate with your dispensing system through, the dispensing system refilling like RX Local and things like that. It's mobile responsive, it's HIPAA compliant, and then we maintain it for you as well with monthly health blogs, ADA accessibility widgets, all those fun things.
Awesome. So thank you so much for sharing that information, and please put your contact information up in the chat so people know how to reach you. My friend Jonathan with Breath Rocks is at a conference today, and so I told him I would share this wonderful product, front-end product for your pharmacy. If you haven't seen this yet, absolutely amazing product. It's a functional breath mint. It's taken the old Pop Rocks candy and turning it into a functional breath mint. And you've probably seen this if you've been to any of the NCPA conferences. We launched it here first on the Roundtable, and now is successfully going across the country, and it's even getting into the convenience stores now. I think Circle K is the first big chain of convenience stores that is putting this in. But a really fun and functional product that I personally enjoy. My family loves it, and they're coming out with some amazing new flavors as well. Jonathan has some great ideas when you're, doing detailing out, talking to doctors about your pharmacy and directing patients into your pharmacy. Don't bring them, donuts. You're not a donut shop. Bring them something like this that they'll really remember you by, because it is something you also carry in your pharmacy. The other idea that he had that I love about this is if you're doing vaccinations and you have a patient that's really afraid of needles, give them a little taste of this, pop it in their mouth, and while that little party's going on in their mouth, then you can give them the shot real quick, and they won't even realize they just got the shot. So kind of a fun ideas of what to do with the Breath Rocks, and a good keystone markup on the wholesale price to the manufactured suggested retail price as well. I also will announce that he at this Sweets and Snacks conference that he's at, he just got the most innovative new product award, and so that's up on the big screen there at the conference he's at, that he just won that award with the new blue raspberry flavor that just came out. They're also coming out with a mango tahini, which I'm super excited about. That's going to go over like gangbusters here in the Southwest. That's a very popular combination of a mango and the spicy tahini that they put on the mangoes here. So next up to the stage, we're going to show a quick explainer video on the Germs RX MyShield product. So here is that now.
Have you worried about the germs and bacteria your children pick up at school or while playing outside, just to bring those same germs back into the house? Or you have an older parent whose immune system doesn't fight as hard as it once did? Introducing MyShield sanitizing wipes and sanitizing body spray, a more effective answer in the fight against germs and bacteria, available in large or travel size formats. Our cutting-edge antimicrobial nanotechnology, Zetrasil, creates a microscopic bonded barrier on your skin and other surfaces, keeping you safe from 99.9% of common germs for up to 4 hours. Our sanitizing wipes are water-based and stay saturated for longer, allowing you to cover more surfaces per wipe with our proprietary virus and bacteria killing solution. With a pack of these wipes in your bag, it's easy and even enjoyable to sanitize surfaces and skin everywhere you go. They're safe for children, safe for pets, and safe for you. If you prefer a spray to a wipe, our sanitizing body spray includes all the same virus and bacteria killing science as our wipes do. Simply spray anywhere to sanitize your skin or your clothes, avoiding your eyes and mouth for up to 4-hour protection from viruses and bacteria. My Shield's sanitizing body spray is available in 2 ounces, 16 ounces, and 1 or 5 gallon sizes. The sanitizing wipes come in 2 resealable pouches, from a travel size of 20 wipes or a large size of 50. Come get your My Shield on and visit germsrx.com to discover how our innovative products can shield you from harmful diseases and infections.
So I'd like to invite up Scott Lamphere to talk about this amazing product. I love this product. I use it personally myself. I won't travel without it. You'll often see me at trade shows with this on the tables, everybody that we're meeting with, because you're always shaking hands. But what's amazing about this product is that you only have to apply it about every 4 hours, because the efficacy, according to the FDA, lasts 4 hours, which means it probably gives you protection for 5 or 6 hours. So super smooth going on because it's water-based, doesn't have all the alcohol and things that dry out your skin. And so it makes your hands feel good, but then also gives you that 4-hour protection. The other thing too that I'll do is I'll take those wipes with me on the plane, and sometimes I get to travel with my a couple of my little grandkids, and I know they're going to touch everything on the plane. They're going to play with the seat back tray. They're going to play with the seat belts, buckles, everything. So I just kind of wipe them down first, and then I wipe down the armrest, tray table, everything to make sure that we're protected. So. But amazing product. He has a great program. I'll put his contact information up in the chat for anyone that's interested in that product. So is my friend Chris here? Because would love to introduce, there he is, Chris with Pharmacy Marketplace. Why don't you tell everybody about your amazing program?
Yeah, Breck, thanks for having us. So what we're doing at Pharmacy Marketplace is we're trying to take care of a problem that's been going on for the past 20 years in terms of the frustration on how to manage your cost of goods. So most of you pharmacies that have a primary wholesaler, you understand that they have really convoluted metrics around different brand generic ratios, commitments, and things like that a lot of times you really don't understand. So it's hard to align your habits in your purchasing around that. So what we've done is we've developed a technology platform that is AI based to be able to digest all your dispensing information and purchasing information and apply all your rebate metrics to show you exactly where you're at in terms of your deal compliance, and also which items on the secondary market from NABP accredited suppliers that you have access to purchase based on your specific customized inventory needs. So really, it's a way to use technology to make sure that you are maintaining a strong gross profit without damaging the relationships that you have with your buying groups or your wholesaler partners. Essentially, it's just a way to help the drugstore from both a workflow perspective and a gross profit perspective.
Yeah, that's amazing. So
yeah,
so
the big thing to note, Breck, is we're working with a lot of the wholesalers and buying groups now to offer this to their members. If you want to set up a demo, I put a link in the chat to be able to see the platform and ask any questions. And we will be at the Pioneer Show and then some of the wholesaler conferences this summer.
Yeah, that's awesome. Look forward to seeing you there. You'll be also at NCPA this fall as well?
Yeah, I'd say so.
Okay, excellent.
Yeah. Yeah. There's just some call outs in terms of some of the quantitative metrics we've been able to, help the stores with. Right now, we're working with about 1,000 independents, and with some new partnerships we just established last month. We probably will double that in the next 6 months. So there's a QR code to sign up for a demo. There also is a link in the chat with my information. I'd be glad to help you guys. Just give me a shout.
All right. Thank you, Chris. Appreciate it. And again, contact information is in the chat. I'll also provide this as a, in the show notes too for the replay on YouTube. So you'll be able to have it there. So at this time, I'd like to invite my friend Philip Coles to the stage to talk about his program with Good Iodine.
Hello, Breck. Thank you very much for having me. Appreciate it. We're just getting our first iodine generator set up in America in the last 2 days, and we've made iodine, so we're ready to start producing. We're just working out with our GMP facility to get going, so we're very excited about that.
And while you're talking about that, I'm going to take a couple of shots myself to make sure I'm protected.
And feed your thyroid.
Feed my thyroid. And
Yeah.
I actually got kicked off of social media talking about this product as a possibility of my body making its own vaccines. And social media didn't like me talking about vaccines, so they booted me off that.
Yeah, unfortunately, until we will be an OTC product, we are going to go through those trials, and we are going to be a cold and flu product. We're going to be a prenatal product. But for now, we are thyroid support and immune system support. And the immune system support is on 2 levels. Nothing kills bacteria and deactivates viruses and fungus like iodine. And, I loved in my lectures, the very last thing that I say is love them or not. When Trump was talking about injecting a disinfectant into himself, he wasn't talking about bleach, and he didn't say bleach. He said disinfectant. And there's no better disinfectant on the planet than iodine.
Yeah, that's why they still use it in the surgical suites, right? I mean, that's absolutely the solution that's put on the skin before they ever cut. So
yeah, and that technology in the 70s was game changing, or was it the 50s? Sorry. It was the povidone iodine when plastics came along. So that's povidone iodine that they use in the hospitals. And there are products available in America. Immune Mist and Cofix RX are both products that are made from povidone iodine. And what that technology is plastic particles impregnated with iodine. So that's why it's so stable.
So specifically for our community pharmacies, really focusing on the thyroid and the synthroid market place, what offering do you have? And I'll need to update my slide here. This was a last year's program, so it may be a little different today. So please tell our guests what is in it for the pharmacy, the community pharmacy today, and how they can use your program.
Well, I had sent you some text this morning just trying to figure out what we can do as a consignment basis to begin with. And we're thinking that if each pharmacy is working with 33 customers that want to try to do the Synthroid review with a 3-month supply of good iodine, that they could have 50 pharmacies that we could start with 33 customers, because each customer that's on Synthroid would be trying to use 5 sprays a day of good iodine each day for 90 days. And we're asking them to fill out a questionnaire with a number of questions: their weight, how they feel, if they can get their blood work done. That would be excellent, because what we're looking to do is to see if they can make their hormones, their T3, T4 hormones, naturally.
Yeah.
And possibly wean off of some of the Synthroid. We're not thinking that they're going to eliminate Synthroid from their regime, but maybe that they will be able to produce natural T3, T4s naturally with their thyroid. And how that's going to happen with good iodine, just so you understand, is that the thyroid won't use molecular iodine, and humans don't typically consume iodine. They consume foods rich in iodide or supplements that are made of potassium iodide. And the problem with potassium iodide is you have to separate the potassium from the iodide in order to use the iodide. So it's not an easy process for the body to complete. With our product, it actually happens very quickly. The I2 breaks apart into 2 iodide molecules, and that goes down into the stomach and past your thyroid every 16 to 18 minutes and converts into the atomic iodine that attaches.
So Phil, when we did this promotion last year, the pharmacies that took advantage of the consignment, they sold out immediately. So first 50 pharmacies that reach out to Philip will get the on consignment program. Start with your first 30 or so patients that are on Synthroid. This will not only help them metabolize that medication better, but also improve the health of their thyroid. So wonderful program. Please put your contact information in the chat, Philip, so people know how to reach you, and we'll also put that in the show notes as well. So
Brett, can I add?
Sure.
Can I add something to Philip? Hi, Philip.
Hi, Anand.
Yeah, I don't know. I don't know you. This is my first time on the call. So if you'd like, I could introduce myself a little bit, and then I want to comment on something Philip said.
Yeah, please do.
Okay. I'm a pharmacist from many years ago. Had my own drugstore also, but then I switched to anti-aging and longevity about 30 years ago. So that is my specialty right now. I use a lot of cutting edge stuff, research, like one of the things is iodine, which I've been tracking for a long time also. Um, the average iodine intake for Americans is about 1 to 2 milligrams per day. In Japan, is 13 milligrams is the average per day. And they have some of the lowest rates of esophageal cancer and a whole bunch of other things. So that is a huge difference between 1 milligram and 13 milligrams daily intake. So that's one point. And I've been using, and I've followed also the work of Dr. Lee also for many years. He was one of the pioneers in this also.
Yeah, well, thank you for sharing that.
So just if I can comment very quickly, sorry. What we're actually consuming is iodide.
Correct.
And what happens in our stomach is a certain amount of the iodide in the food that the Japanese or anyone is eating is being converted into molecular iodine in the belly. And
Right.
It only happens with the hydrochloric acids, which is a small percentage, 0.5% of the acids in your stomach. And that's how our body makes molecular iodine. And very interestingly, then molecular iodine and iodide go through the blood, past the thyroid every 16 to 18 minutes, and the thyroid only takes out iodide and converts that into a single positively charged atomic iodine molecule, and then it stores it and attaches that to the T3, T4 hormones. So, it is one of those interesting things that we're actually, this is the only product that's ever been available of a pure iodine oral spray. Everything else has been either povidone iodine with plastic, or it's been a potassium iodide product. When you're consuming it with food, you're getting iodide. But when you're consuming a supplement, which is a potassium iodide, the interesting thing about that is that Lugol's, back in 1812, was the first doctor to develop this. And the potassium iodide was used as a solvent to dissolve the iodine in the liquid. And with typically Lugol's, you're getting 18 milligrams of combination of molecular iodine and potassium iodide, 2 to 1. And the thing that we're seeing in one of our studies, if you look at goodiodine.com and look at our studies there, you'll see a Ghent study. And I've been looking for this study for quite a while, and I found it and I put it on my website. And that was women were drinking 6 milligrams of our iodine, of a molecular iodine, each day for 6 months to remove fibroids and fibroid cysts. Potassium iodide didn't work. And if you're going to consume enough iodide to make enough fuel for the thyroid to turn into atomic iodine, you're going to need to eat 15 pounds of cod or haddock. Those are the two fish that have the highest count of iodine in them each month. And you're absolutely right. The Japanese have the lowest rates of stillborn and young infant deaths. They have the
Philip, we could do an entire podcast just on this, and we have, in fact, done it on the Well Wave now, but we do need to move forward on this. Please put your contact information up in the chat. Amazing product, amazing information. Basically, everyone has an iodine deficiency, and in order to replenish that is through the iodine. And so thank you, and please put your contact information up. Real Value RX is a wonderful supporter to the show. They're a secondary wholesaler out of San Antonio, Texas, been around for 36, 37 years now. Is Tom or Jessica here today to tell us more about their program? They are also a partner with the RX One Shop. And RX One Shop is our title sponsor. Doug would normally be here, but he's working with a client, which is what he should be doing. But over 30,000 NDCs. Basically, what they do is they do the shopping, find the deals for you, which is a huge time saver. And then you can save on money by making sure that you're getting the right product. The other exciting thing that Doug and RX One Shop has done is they've launched a partner page on their website, which the Community Pharmacy More Profit Roundtable is a partner on their website. And you probably, if you get his emails on his specials, you'll have probably gotten the email about this meeting today. So RX One Shop, a wonderful partner for the podcast, the Community Pharmacy More Profit Roundtable podcast. Again, they do all the shopping and find the deals for you so that you can save. So we appreciate their partnership. So next up, we want to talk about this HYPER program. It's not in every metropolitan city yet, but it is coming to a city near you. You can reach out to them. There's a QR code, or I'll put the link in the show notes so you can see if they're in your town yet. But this is same day delivery. So all the community pharmacies that provide delivery services, you need to check out the price on this. So just $7.95 in most cities. In New York and California, I believe it's $9.95, but still that's a flat rate. Some of the other courier services, they say they have a flat rate, but then they add on a fuel charge and a time, and pretty soon you're paying $15, $16 per delivery versus the $7.95. So we'll leave some information for you to see if they are in your area yet, and they are completely HIPAA compliant. Also, another program for community pharmacies is the ACA program. This is a 30-second quiz. If you see your patient is underinsured, or if they don't have insurance when they come in to pick up a prescription, you can offer this to them. And there are TPAs standing by, brokers standing by to check and see if that patient is eligible for one of the many programs through the ACA or Affordable Cares Act program. A finder's fee is paid to the community pharmacy for every patient that enrolls. So that's just a mailbox money program for community pharmacies. Put that information in the chat as well. And next up to the stage, I would like to invite my friend George Veronis with Seniors Home Services Remote Care Today.
You're not showing a video, Breck?
No, you are the video today.
Oh man, you're killing me. It's changed my whole talk track. So let me get my thing. Well, anyway, that's a little rougher, but I will say we've been on this several times. There's probably a lot of past videos. But basically, we have a program, remote therapeutic monitoring, and there's several programs that we use that affect the brain from a cognitive standpoint to help patients with their memory, avoid dementia, a lot for coordination and balance. And it's all covered by Medicare, both Plan B and Advantage. And one of the reasons is because Medicare spent just last year an average of $30,000 when a senior would fall, and about $31 billion over the years. So I saw this program several months back. I became the vice president of sales and marketing for the company called Seniors Home Services. And we were mostly going to doctors because we were doing remote care and offering also RTM as another program. And I ran to Breck and I asked him what he thought about it. And we had done some business in the past. And he said, hey, why don't we go into the pharmacist? They could actually do an administrative, offer this for an administrative fee. So they didn't need to offer Medicare. We have our own NPI number, but we needed more people to bring it in front of patients. So he said, take it to the pharmacist. We were able to offer $25 per patient per month for this administration, which takes about 1 minute per patient. So Brad said, look, if you market this and we could put 100 patients per pharmacist, that would add an extra $2,500 in, as he likes to say, pure profit. There's no cost to this program. There's no money out of pocket. There's very little effort. It's literally 2 hours a month if you had 100 patients, which would come out to about $1,200 an hour. And if you get 200 patients and 300 patients, obviously you can make 5,000, 7,000, and so on. And the other reason it came about is I know Breck's going to talk about medical billing and credentialing with IPPN, and their cost is about $7,500 over a 3-month period. So we said, look, if you implement this, our profit will actually pay for the medical billing, and then everybody wins in 2 ways in a big way where they could even make more profit. So anyway, it's a great program, and what I recommend for pharmacists is to set up a 15 to 20-minute appointment with us that we can answer your questions, actually show you a few videos, which I would have showed today if I knew we were going to see one. And then through that, it ends up being a great program. And I can tell you, we probably met with 200 pharmacies, and we haven't had a pharmacy yet not want to implement this in the program. So thanks, Breck, and it'll lead to the IPPN talk, and I'll put my information in the chat.
Yeah, thanks, George. And yeah, when George brought this program to me, he knew I'd been preaching clinical services to pharmacies for the past 2 years, and so this was a way to pay for that, credentialing and implementation of those additional clinical services and getting into network with the payers. And so there's a lot of wrong ways to do this, a lot more wrong ways than right ways. And so I've been investigating them all. And IPPN is absolutely the right way. When I saw so many of my pharmacy partners going down this path, trying to get into the payer networks and paying thousands and thousands of dollars. I had one partner pay over $50,000, still didn't get across the finish line, and so many people paying 16, to 20,000, and then kind of getting left on their own. And then I saw another partner of mine that had actually got into the payer networks and started doing services, but then couldn't collect. He's not able to collect on his bill. So I mentioned all those concerns to a healthcare consultant that I knew. He said, I need to introduce you to somebody. And so he introduced me to Ray Bona. Well, Ray had been working in healthcare technology for 20 years. He actually spent 16 years working with CMS. So he had been seeing all the care gaps. He saw that there were services that weren't getting done because there's a shortage of primary care providers. And he helped develop the quality measurement scores that Medicare, Medicaid use to see how well the preventative services are being done, because they understand if we can prevent a lot of things and catch things early on, it's going to save them billions of dollars literally on the back end from hospitalization and other things. And so Ray took that knowledge and that experience and was taking a program again into the doctors to try to fill those care gaps until he met me. And I said, we need this program for pharmacies. And so absolutely did a shift about 180 degree. Ray started the Independent Pharmacy Provider Network and created a turnkey solution for our pharmacy partners. Now, I know Ray was at another appointment. Are you here yet, Ray?
Yeah, I'm here. Thanks, Breck.
Yeah.
I got in a little late. I appreciate it. Thank you. Yeah, really, as Breck said, this is really to be able to help fill some quality gaps, quality healthcare gaps We work with doctors. This is the difference here. We work in collaboration with doctors on behalf of the pharmacies. And we spend a lot of time making sure that the pharmacies can be set up in order to actually bill and get paid for their services. So we've got, in addition to just meeting some of these quality gaps, you're also providing services to their patients. For instance, continuous glucose monitoring. Many pharmacies are doing this. They're adding those devices, those Dexicom devices. They're looking at the results, but what they're not getting done is they're not getting paid for that time. So we make that happen, and we do that in collaboration with doctors. So it's very important. We've been spending a lot of time lately making sure that the pharmacies that do enroll with IPPN are actually able to bill, that they're set up in a proper way to be able to bill. There's a lot of questions out there. Some pharmacists feel that they can just go out and start writing scripts and billing, and in some states that's the case. But guess what? You can't get paid for it for Medicare, which is a national payer. They will not recognize that pharmacy, but they do get recognized under our program because we're affiliated with the providers in their local markets. What Breck is showing now is just a four four keys to success: the application, the collaborative practice agreement, the provider recruitment, as well as the contracting and the providing the credentials to these payers. These are also the four keys to failure. So we've become very much an expert in all four of these areas. We have our own application. We've developed our own contracts. We do provider recruitment utilizing our tools that are really unique to our program. And then we also help with the contracting, credentialing, and billing, and adding different programs to bill. So that's it, Breck. I think you can. I didn't want to take up too much of your time. I know you're behind schedule a little bit, so we can move on. And if anybody has any questions, our information will be in the chat, and you can contact us at anytime. Thank you.
Yeah, thank you, Ray. Appreciate it. And so I've outlined the three steps for success for clinical services for community pharmacies here on this next slide. So step one is the remote therapeutic monitoring program that George spoke about through Seniors Home Services. There's zero startup costs for that. So book a demo to see how to set your pharmacy up in doing that program. Step two is getting credentialed for medical billing through the Independent Pharmacy Provider Network, or ippnhub.com for more information. And then step three is a full brick and mortar clinic. Now, that's not going to work for every pharmacy because you have to have a space for it. You've got to have about a 10 by 12 footprint to be able to put up the walls and bring in the exam table and all of the equipment that's needed for that clinic. But those are the three steps there. You can obviously do step one and step two independently. You can do them together. You cannot do step three without step two. You absolutely have to be credentialed and set up in order to even think about doing the full brick and mortar. But one of the benefits of the full brick and mortar with Brim Wellness is that even though the pharmacy owns the clinic, it can be completely managed and even staffed for you. So there's a cool thing called the Talent Exchange, where you don't have to have a full-time nurse or medical assistant in there unless you have patients to be seen. And so their Talent Exchange is like, imagine Uber for nurses. So they only fill the shift when you have a shift to be filled. So it's real time assistance that way. Then the third leg of this stool I love is a financial vehicle that will not only help pharmacies set up and do the build out, but then as you pay back the pharmacy fund, each pharmacy then becomes a cooperative member of that fund. So you're helping the next pharmacy build out their clinic, but then making a very fair reimbursement, on the interest earned from that pharmacy fund. So really cool financial vehicle that not only are you making extra from your clinic, but now you're also a part of the pharmacy fund as well. So At this time, I'd like to turn some time over to Dr. DeMar Lewis to tell us a little bit about what he can do for pharmacies in helping them double their profits. And then we're going to get into talking about, is your pharmacy incorporated correctly to take advantage of 20 to 40% less in taxes. So Dr. DeMar, did you want to share your screen or do you want to just visit?
Yes, if I can share the screen, that'd be great, Breck. Thank you.
Yeah.
So there's been a lot of information today about different ways that you can kind of really diversify your pharmacy operation. And I'm a pharmacist. I've been a pharmacist practicing for over 40 plus years. And what what I've noticed, I've transitioned to working with pharmacy owners, helping them to really grow their pharmacy practice through profit acceleration. Most pharmacies are struggling, and pharmacies are closing in California here at a rate of essentially one a day, and that number is just continuing to increase. And part of the problem is that there's not when I talk to pharmacy owners, they're struggling with what to do next. And there's a lot of opportunities out there. But the issue really is really defining what their market dominating position is and how they're competitively advantaged in order to serve that population. And that's really what I help them do through coaching. So that instead of just chasing the shiny object, whatever that is, and going in many different directions, and really spinning your wheels, what I'm really focused on is really using profit acceleration, looking at 12 different areas within every business and creating a roadmap, and doing the right things, because too much pharmacy owners are in their business and they're not really working on their business. So I'd love to spend 45 minutes with you, show you where you can within 30 to 60 days realize at least double your profits, and within 12 months see at least $100,000 in profits within your business, looking at 12 specific areas, those same 12 specific areas that places like McDonald's, Walt Disney have been using for decades. Thank you.
Awesome. Thanks, Dr. Lewis. And at this time, if you'll stop sharing, then Richard, I'd love to have you tell us about your program. If you haven't done a free analysis of your business structure, please take advantage of that, because Richard's company is able to help you not only save on your I love the question, do you think you're paying too much in taxes? Well, everybody thinks they are. So check into it, see if that is something that Richard's organization can help you with. You're on mute as well too, Richard.
All right, let's try that. How about that? Better? Okay, did you want to do the video of Breck, or do you want me to go straight through? Do you want me to do a PowerPoint?
Yeah, we've got about 7 minutes. So whatever you feel best, you can share your screen and go from there.
Okay, I'll do that. Let me share screen here. We'll go there and there. So let's talk about everybody can see the tax strategy analysis?
Yes.
Great. So let me thank you very much, and let me just walk through this. Should have plenty of time. Here's the issue. The issue is that if you are a successful business in the United States today, and you are a sub-S corporation, LLC, partnership, sole proprietorships, you are probably paying your taxes, overpaying on your taxes, typically by 20 to 40%. And the reason for that is that most businesses are pass-through entities, which are sub-S, LLCs, et cetera, and they are not taking advantage of all of the statutory tax breaks that could be available to them if they're properly structured and with the right strategies. If you're an S corporation, you're missing out on the advantages of a C corporation. If you're a C corporation, you're missing out on the advantages of an S corporation. This is not critical of tax preparers and CPAs because tax preparers are doing what they're supposed to do. They need to focus on compliance. You need to be able to file your taxes, pay your payroll taxes, make sure you're taking your depreciation, doing all of those things. But there's over 74,000 pages in the IRS code, and no one can be a specialist in everything. So what we do is we focus on reducing the taxes of business owners. There's all kinds of benefits. I won't go into detail on them, but trust me, it is very, very typical for us, which we have found for many pharmacists now working with Breck, that we are saving them $30,000, $40,000, $50,000 a year in taxes. And that's not just 1 year, that is every year, because once you've implemented the strategies, those strategies last for the life of your business. So what's the answer? The answer, we think, is us, Tax Law Associates. We are a tax law group. And what we do is we focus, as I said, on reducing the taxes of business owners. And we've been doing this since 2002. We have almost 4,000 clients in all 50 states. The reason why we're able to reduce taxes by 20 to 40% is because we approach the tax reduction in both a legal and an accounting methodology. Our managing partner of the law group is a man by the name of Mike Fussell. Mike is an attorney. He's a master's of law in taxation, a member of the U.S. Tax Court Bar, and he is a CPA. He's been doing this for 27 years. I tease him about being an underachiever. He has more initials after his name than I've got in my entire name. So he's been doing this for years and years and years. He has never been audited because we follow the laws. We are statutory in nature. There's no gray areas. I won't go into detail, but what we do is we create a multi-entity structure for you because entity structure is a legal, not an accounting issue, and we help you take advantage of all the good stuff that's available in an S corporation and in a C corporation. There are two parts to the program. One is hard dollar savings. Literally, the dollars reduce on you can do it on your W-2, you do it on your quarterly payments that you're making to the feds and or to the state, and actually reduce the hard dollars. But in addition to that, we're going to be looking at all kinds of other areas for you. Entity restructuring, review of the real estate holdings, asset protection, estate planning, all kinds of different programs. We're not going to replace your current financial advisors, estate attorney, accountant, CPA, and we don't work in the gray area. We'll defend if there's an audit, if there were to be an audit, but we haven't had an audit on our stuff for 27 years. As I said before, we do not color outside the lines. What we do is statutory in nature. We just know how to do it because we've been doing it both from a legal and an accounting standpoint for the last 27 plus years. There's a fee obviously in this, but it's a one-time fee. You will have an ROI in the first year of at least 80–90% ROI, depending on your particulars, obviously. Over a 5-year period of time, the ROI approaches 1,000%, and then it continues there because the fees do not continue, but your savings do. So what I've done on that, I won't go into the detail here, but working with Breck, what we do offer is a complementary analysis. We'll give you the minimum taxes that you would save by implementing the strategies. Like I said, no obligation. Take a look at the numbers. Let the attorneys take a look at it. Do the calcs. And we'll come back with the minimum taxes we have, as I said before, working with Breck, any number now of pharmacies who have taken advantage of this and reduced their taxes dramatically. I put my information in the chat, so it's there. Give me a call, give me an email, and let's sit down. Let's talk for a half hour and see whether or not this is something that is workable for you. I'm happy to take questions. Did we make it by? Yes, we did it before. We did it before the top of the hour, Breck. Congratulations to us.
Good job, and thank you, Richard. Appreciate you and all of our presenters today. Thank you so much for being here and presenting on the Community Pharmacy More Profit Roundtable. This full hour-long roundtable is only once a month, the second Wednesday of each month. You can find the replay for this, and I'll also send out an email to everybody that registered today. Quite a few people that registered so they could get the replay because they knew they were going to be tied up or have patients that they needed to work with. So that'll be sent out later once it renders. But thank you to all our presenters. A special thank you to also RX One Shop for being the title sponsor. And check out their new partner page, because we're front and center. This roundtable is front and center on that partner page. But again, thank you everybody for being here, taking time out of your busy schedule to be with us.